All right, hello, and welcome to our surgical management of kidney stones talk online here at the Cleveland Clinic. I'm Fabrice, one of the endourology fellows, and I'll be moderating our discussion today. All right. So our experts that are with us today, we have Dr. Jorge Gutierrez Aceves. He is the Center Director for Endourology and Stone Disease here at the Cleveland Clinic. He completed medical school and residency in urology in Guadalajara, Mexico, and went on to an endourology fellowship in Germany. Since he has served as the president of the Urologic Society and currently serves as the Assistant Secretary of the American Urologic Association for the Americas. He currently specializes in stone disease and BPH, and he sees patients currently at main campus here at the Cleveland Clinic. Our next panelist is Dr. Anna Zampini. She's a staff endourologist here at the Cleveland Clinic. She attended Tufts University for undergraduate and medical school. She obtained her MBA from Brandeis in 2019 and then completed a urology residency here at the Cleveland Clinic and went on to an endourology fellowship at Mount Sinai. And she returned to a staff position here in 2020. She specializes in stone disease as well as upper tract urothelial cell carcinoma, and she currently sees patients at Cleveland Clinic main campus, Avon, and Fairview.
Okay, so we always get asked the question, who gets kidney stones? Well, kidney stones happen most often as we get a little older in our 4th and 6th decades of life. Traditionally, men are more likely than women to get kidney stones, but this is definitely changing, and there's definitely now a trend towards women also getting kidney stones. So if you are a woman and you have kidney stones, you're not alone. Kidney stones have often been found to form in areas where can be dehydration. We call this the kidney stone belt, areas that are hot and dry, or individuals who have jobs or professions that are associated with dehydration can also increase your risk of kidney stones. There are several diseases that are associated with kidney stones that can increase your risk of either having stones or having stones again if you've already had them once. This includes overweight, having a metabolic syndrome, type 2 diabetes, and also stones can increase the risk of other diseases such as hypertension, cardiovascular disease, diabetes, and kidney disease as well. Now, there are several different kinds of stones. The most common kind is a calcium-based stone called calcium oxalate, and this is probably about 60% of all kidney stones that we see. There's also other kinds of calcium stones, one that's called calcium phosphate. This is more rare, but tends to happen in women or in some individuals who may have infections. We also see uric acid stones, and this is really associated with diabetes or being overweight. It can also happen in relation to other diseases. And in some cases, although rare, we can see infection stones or what we call struvite stones, which really form because of bacteria in the urine and can't be cleared or be removed unless we remove the stones and the infection together. The most rare kind is called a cystine stone. This stone traditionally shows up very young in life because it's actually a genetically formed stone. And so why do stones form? There's a concept that we call supersaturation, and this really leads to stones forming and growing. And really it describes how many of the stone building blocks there are versus the factors that prevent stones. And so we use this term to kind of describe an individual risk of forming a particular type of stone. And then there's several steps in stone growth. So stone factors can clump together and start to form a stone. You can have different crystals that can form on top of one another, growing a stone, or you can have different crystals that can group together and form a stone. In some individuals too, you have stone crystals that drain out of the kidney well and therefore can grow. And now, what are some of the different stone factors? In really general terms, we have things that promote stone formation, which are traditionally bad, and things that inhibit stone formation, which are traditionally good. This includes, in terms of promoters of kidney stones, calcium, sodium or salt, oxalate, which is a compound in a lot of foods that we eat, as well as something that our body makes on its own and naturally, urate or uric acid, and then cysteine. And then inhibitors of kidney stones, again, are things that can be protective against kidney stones. And this is citrate, magnesium, phosphate, and anything that dilutes out or diffuses the risk of other stone promoters, which is why we really say that having a lot of water intake and drinking a lot of water can inhibit your risk of stones. Overall is the balance of the good and the bad. You don't want to eliminate all the promoters, but you want to create a balance that favors not forming kidney stones. So what do we need to know before we can choose a treatment option for you if you do have kidney stones? Number one is, where is the stone located? Is it in the kidney or is it in the ureter? And the way we find out whether or not you have a kidney stone, it's really the best test is going to be a CT scan. So often, even if you come to us with the diagnosis of a stone on an ultrasound or an x-ray, we're often going to request a CT scan to confirm the location and really know exactly what we're getting into. Next is the shape of the stone, and sometimes we can't really discern this on a CT scan, but we can sometimes see a difference in the shape on that CT scan. So some stones are smooth, some are kind of spiky or have different kind of outreachings of them, and some are really, really sharp. All of these can contribute to how easily a stone may pass on its own, and also may influence what kind of surgery or treatment we decide for you. We also want to know how many stones there are, because if you have many stones in different areas of the kidney, or if you have stones in both the ureter and the kidney, that may change what options you have for treatment. And again, we'll see that most often on the CT scan. We want to know how hard the stone is. So if it's a very hard stone, this also limits the types of treatments that we can offer. But also how hard the stone is can also give us an indication of what it's made out of. And if we know what it's made out of, sometimes we can avoid surgery. It's not often, but it's sometimes the case. And then finally, I guess I kind of alluded to, what is the stone likely made from? If we can help kind of determine what it is just from a CT scan, which is not common, but still possible, sometimes we can choose a therapy that includes the dissolution or trying to dissolve the stone rather than surgery. And even though I say that, please note that that is less common, and the most common thing that we tend to do for kidney stones that need treatment is a surgical procedure. So what else goes into making the decision about treatment? Well, we need to know about the body size, because a lot of our therapies depend on getting through into the kidney, so going through the body to reach the kidney stone. And if we have more tissue to go through, sometimes that can change which treatments we're able to offer. We also call this the skin to stone distance, which is again that distance to the stone through your body. Whether or not we see swelling or hydronephrosis in the kidney, which is a backup of urine. This happens often if we have a stone in the ureter and it's stopping the urine from flowing from the kidney down into the bladder. Sometimes differences in the renal anatomy or renal anomalies can actually change how we decide to treat stones as well. Whether or not you've had prior surgery, or if you've had a tight ureter or what we call a stricture in the ureter. Also, there's something called an infundibular pelvic angle. It's a fancy word, but really just means how sharp is the angle from the ureter to the stone. This is just a schematic that shows some of the different locations or some of the factors that may be influencing some of our surgical decisions. And then in general, what are the options for kidney stones? The least invasive option is something called shockwave lithotripsy. Now this is what a lot of people come to us and say, I heard about lithotripsy, I want lithotripsy. Well, this is what we call shockwave lithotripsy. And in this instance, we use sound waves to target a kidney stone and to break it up. It's the least invasive, meaning we're not putting any instruments into your body, but traditionally for large stones, it has the lowest stone-free rate, and it can be affected by several factors, including how large your body is, including how far away the stone is from the surface of your body, how hard the stone is, the number of stones, and the location. There's also a risk of needing several different procedures rather than just one, but in some cases, it's an excellent option and it's something we do recommend in the right patients. The next option is the level of invasiveness is called ureteroscopy, and we shortened it here for URS. This is our least invasive or endoscopic procedure. It is an outpatient procedure, and it has a high likelihood of success, but it often carries the risk of what we call morbidity or pain associated with a ureteral stent. Not needed in all cases, but it's something we always have to talk about. The most invasive, but often the most efficacious or the most successful, is something called percutaneous nephrolithotomy, or PCNL. This has the best stone-free rates in the right patients and may eliminate the need for a stent in some. The results are traditionally not affected by some of the other factors that I mentioned earlier, such as renal anatomy or strictures, and so sometimes this is the best option, even if it is a slightly more invasive procedure. So just to show you a picture, this is shockwave lithotripsy. When it was first developed, this is the one where individuals or patients had to be actually submerged underwater in order to receive the therapy. Now it's advanced so that we just have the patient on the bed and we have this little transmitter on a gel, kind of a gel cushion, and that's how we emit the sound waves instead of a whole water bath. Okay. The sound waves then break up that stone when we target it with an X-ray, and the stone pieces or dust do paths to be eliminated. The next option is again that ureteroscopy, and here we use one of the small camera that you can maybe see on the left of the screen. It's a small, long, thin camera, and we use this to advance into the bladder, into the ureter, directly visualize the stones in the ureter or kidney, and then either remove them intact or laser them into small pieces and remove them through the ureter with the camera under direct vision. This is one of the most commonly used instruments in all of urology. And while it sounds a little weird, it's something that we do day in and day out and are very comfortable with. And in this case, you don't actually have to pass the stones. We traditionally remove most of the stones for you. Here's just a little example to show you a little more in detail what it looks like. You can see the camera here going into the bladder up to the ureter. We use a little basket and we use a laser to actually break up the stone and to visualize it directly. The next one is again the percutaneous nephrolithotomy, or PCNL. And here we're actually making a small incision into the back, directly into the kidney. And it's very small, and there's two different ways to think about it. One we call standard and one we call mini. Here at the Cleveland Clinic, we really like to offer the mini PCNL because it can be even less invasive than the standard. It allows us to make a very small incision and sometimes even have you go home the same day after surgery. And in this case, we use different kinds of what we call lithotripters or other devices to break up the stone. And this time we can use laser or sound waves to do so. And it's a very technology savvy kind of surgery. So we use lots of different instruments and we really do our best here to remove all the stone pieces that we can so that you don't have an acute episode or have to pass any stone fragments. On the left of the screen, if you can see it, the incision with the mini PCNL is about the width of a pencil. So when I say it's small, it really is quite small. And then finally, this is something a lot of patients do ask us about. A ureteral stent may be used after any one of our surgeries. And it's a small plastic tube that's job is to really hold open the ureter and help the urine drain from the kidney through the ureter into the bladder. Stones don't flow through it, they flow alongside of it if there's little dust or urine. And the job again is kind of like a doorstop. It just props everything open so that urine can drain unobstructed and relieve any pressure or pain you might have. It's traditionally then removed in the office or with a little string at home. And as weird as it may sound, it's really well tolerated and you'll be done in about 2 minutes once we take it out. And with that, we'll open it up to questions. You had some questions too.
Yeah, I think this is what we go. We take a more intense.
All right, so one question we have is, what about milk? Should we avoid drinking milk?
I can take this one. So Dr. Gutierrez, nice being here with all of you today. So yeah, contrary to what we thought in the past, calcium is good. It's a good indication for people even forming calcium-related stones. And we always suggest that keeping your diet with dairy products, for example, will be enough to keep you enough calcium in your diet. There is no contraindication to have dairy products, even if you're forming stones with calcium. And the main reason is the calcium will block the second most frequent component of the stone, which is oxalate. And this is one of the reasons why many studies have proved and shown that having a diet with calcium will decrease the risk of stone formation, contrary to what we used to think in the past.
And then previously submitted question, kind of on that in that same vein, is what are your thoughts on taking extra calcium plus vitamin D daily on top of a daily multivitamin?
So there is few reasons to have a very high level of oxalate. And for example, if you have low citrate level, which is a very frequent thing, we can add medication to increase the level of citrate. And you have a high level of, let's say, calcium. We have some medication that can decrease the level of calcium, but we don't have any medication to decrease the oxalate level. So the only thing that we can do to decrease the oxalate level, again, is have, number one, calcium in the diet. But if you have some condition, like, for example, a history of gastric surgery, then usually the oxalate level is going to be very high, and we do recommend to have a calcium supplements. Calcium supplements in that scenario will help to decrease the amount of calcium and oxalate in your diet and your urine, sorry. And again, oxalate in combination with calcium is the most frequent type of stone. So to your question, yes, we can suggest calcium supplements, but in particular conditions where the oxalate level is very high.
And then again, related to that, how important is diet in preventing oxalate stones?
So diet can be important for some individuals, and there's a couple of things to think about when we think about diet for oxalate stones. One is foods that contain high oxalate content, and this is where we traditionally look to avoid certain foods such as almonds or spinach or certain very high oxalate containing foods. However, most diets that are full of healthy leafy greens or healthy fruits and vegetables also have oxalates in them. There is no good data that says eliminating oxalates will reduce your risk. Therefore, we try to reduce the total amount of high oxalate containing foods and not necessarily eliminating oxalates from the diet. It's about reducing, not eliminating. Additionally, as Dr. Gutierrez mentioned, if you have calcium in your diet, you can actually bind some of the oxalate in the diet as well, and we eliminate it through our bowel movements rather than absorb it and take it to our kidney. This is why having a diet rich in calcium-based foods, whether it's dairy or non-dairy sources, can actually help reduce your risk of oxalate-forming stones.
And then for prevention, does it matter what type of liquid or fluids you drink to stay hydrated, or only water?
I think this is a good question. So number one, what is more important is the volume of liquids, and let me tell you why. Stones are nothing else but the concentration of salts. If these salts that the kidneys excreting are not washed out, they will form a crystal, and the crystal will be the nidus of any stone. So the problem is that people who form stones probably may eliminate or excrete more salts. So volume or liquids washing out these salts is the most important thing. And based on all studies, the only type of liquid that we do not suggest is sweet drinks or sweetened drinks. There are several studies that prove that having, for example, sodas, especially black sodas, may be not very good for stones. Other than that, it's important to tell you that basically everything else you can drink safely. Coffee is okay for stones. There is no contraindication to drink coffee in some formats. Good news is beer is okay, wine is okay, no contraindication. And tea. The tea may be a limitation because the green leaf of the tea may be rich in oxalate. Here in this part of the country may not be a big issue, but I was in the south part in North Carolina 10 years and people drink a lot of tea there. Green tea, again, the leaf of the tea has a lot of oxalate, so we do recommend for people drinking a lot of green tea not to do this because of the oxalate content in the leaf. Again, basically the only thing that we do suggest not to drink are sweet drinks or sweetened drinks. Most importantly will be water. Again, the most important thing will be a total volume of 3 liters a day, which is 96 ounces a day, in order to allow your kidney to produce, to eliminate, to excrete around 2 liters a day. This is what you need to be drinking in order to prevent stones.
And if you're a vegan, what can you do to help reduce oxalate stones? Things like nuts, spinach, and sweet potatoes are high in oxalates.
That is totally right. That is totally correct. I frequently hear this question, and unfortunately, we don't have a good answer. The only thing I can tell you is yes, nuts and almonds are probably one of the few elements that have a higher level of oxalate, and spinach, which is unfortunately part of the diet of a vegan. So unfortunately, if you have this, probably the best suggestion will be to keep in your diet calcium. Be sure that you're eating calcium in your diet. The recommendation from our guidelines suggests that you need to keep a diet between 800 and 1200 milligrams of calcium. And if you're vegan, probably you need to increase a little bit more this amount of calcium, again, because the calcium at some point will or may block the oxalate, and that will prevent to be excreted in the kidney.
And then, does adding lemon juice to your water help to reduce oxalate, or help to reduce oxalate stones?
So great question. Lemon juice, orange juice, the juice in some melons and fresh tomatoes, as well as lime juice, all contain some citrate. And citrate is protective against kidney stones because it actually binds to or complexes with the calcium and oxalate ions to prevent them from joining to each other and forming a stone. So that can be preventative for kidney stones. So it definitely doesn't hurt you, and in some cases we highly recommend it, drinking extra lemon, lime, citrus fruits to increase that overall amount of citrate in the urine. Additionally, you asked about whether or not stones can be dissolved. Oxalate stones, calcium stones cannot be dissolved. The only kind of common kidney stone that can potentially be dissolved is a uric acid stone. Uric acid stones need a urine pH greater than 6.5 to be dissolved. We have to check that with a lab test or pH strip, and typically this is with a medication called potassium citrate that we use to raise the urine pH. So unfortunately, lemon juice or lime juice or any of the citrus fruits won't be enough to actually dissolve a uric acid stone.
And what about cranberry juice for stone prevention?
No evidence, not clear. I mean, not scientific evidence that will help. I think when people ask me this, I think what helps is the liquid in the preparation, but not really the grapefruit or the cranberry. So yeah, we don't have any evidence that has proved that the cranberry can decrease the risk of stones.
So we touched on some medications, but are there any other than diet and hydration, are there any other methods of limiting or preventing kidney stones?
Sure. So in terms of medications for prevention, one thing we didn't touch upon yet is a test called the 24-hour urine test. And this is a test where we actually look at the urine itself to see what the urine environment is and see how much of the stone promoting and inhibiting factors there actually are. We do this because stones form in the urine, and if we don't test the urine, then we don't know what's in the urine that's forming the stones or what the risk factors are. So if we're talking about different crystals, which are, coalescing or joining together or leading to stones, what are those? What are those factors? Well, when we look at a 24-hour urine test, we look at how much calcium is in the urine, we look at how much oxalate's in the urine, we look at how much of that citric acid or the citrate that's protective against kidney stones and uric acid. Even when you look at magnesium and salt, all these different factors. And if we see on those tests that the calcium level is really high, and it doesn't seem to be related to diet, it's not because you're taking calcium pill, it's definitely not because you're eating calcium-rich foods in your diet, then there's a medication in the family called a thiazide, which we can use to reduce the amount of calcium in the diet and help reduce your risk. The potassium citrate is also used for both calcium oxalate stones as well as uric acid stones. So those are the two main families of medications that we use for kidney stone treatment.
I will echo Dr. Zampini here because probably if some of you have had stones, you have done this test in the past, and then very frequently we hear, well, we have been doing this and I have not stopped forming stones. But I want to remind, or again, echo Dr. Zampini, this is the only way that we can know what the kidney is excreting. And if we don't know if the kidney is excreting, for example, a lot of calcium, we will not be able to treat properly this condition. So to prevent stones, we need to have two elements, this 24-hour urine, and the second element will be the stone composition analysis. Always when we fragment a stone during surgery, we send the stone fragments for analysis, and that is when we will learn what type of stone you're forming. And again, knowing what type of stone you're forming and knowing what the kidney is excreting, that is the only way that we can start some sort of prevention for you.
And then another question is the lemon flavoring in Crystal Light is the same as real lemon, or does that also prevent kidney stones?
So the lemon and the flavoring in Crystal Light is not the same as lemon juice, but Crystal Light does have some citrate in it, and so it can be, a supplemental source. So I think if you're choosing between lemon juice or Crystal Light, I would choose the lemon juice. But if you like the Crystal Light and it helps you drink more fluids, then please drink it.
Do you have any other suggestions for best foods to add citrate or magnesium to your diet?
Yeah, so citrate comes always with vegetables and fruits and citrus fruit. So we always suggest for somebody who has low level of citrate, sometimes we need to add medication as potassium citrate that Dr. Zampini was referring to. But we start by suggesting to increase in your diet vegetables and fruit. That will increase citrate level. What was the other part of the question?
Magnesium.
Magnesium. I think magnesium usually, unless you have some sort of bowel issue or deficiency of magnesium, that produce deficiency of magnesium, the regular diet will be just enough. It's true that the magnesium is a preventer for stones, but it's rare that we need to treat it. And there's medication that we can add if the magnesium level is low, but usually the amount of magnesium that you receive in a regular diet will be enough.
And then, are there any good studies on the role of genes, diet, or hydration, etc., in terms of stone prevention or formation?
Any good on stone? So in genetics, there are some genetic conditions that can predispose to kidney stones. We're still learning about those now. So in terms of different factors for calcium-based stones, this is really an evolving field. And so we don't really have targeted medications for that quite yet. Although if we do have a strong family history, we do have a colleague here that can do genetic testing to see if there's anything that shows up. But in general, we may see some families with the trait, my father has kidney stones, my mother, my brother, my sister. If many people do have kidney stones in your family, there may be some underlying issue, but however, you can't ignore the fact that diet also runs in family and activity runs in family, so there may be something with that as well. What was the second part of the question?
Diet and hydration.
Hydration, so we kind of touched upon it by hydration, as Dr. Gutierrez said, we're trying to flush out, dilute, eliminate the crystals. And the best way to do that is to drink fluids and hydrate. And as he said, you need at least 3 liters a day or, between 80 and 100 ounces a day to produce enough urine to actually flush everything out and reduce your risk of stone. And diet, I think we've talked about.
That is supported by studies too.
Oh, yes, all of this is supported by studies. So, there's been a lot of large-scale epidemiological studies that have looked at this, and so that's what we base our counseling on.
And what about electrolyte supplements? Could that be contributing to stones?
So I'll just say electrolyte supplements. This is a great question because things like Gatorade or Propel What makes them electrolytes? What makes them good for after exercise? Salt. So they're high in sodium chloride because that's what our body uses after exercise to replenish or to bring the fluids back into our body. However, if you're a stone former, this is not the drink that you should be drinking casually because you're getting a large salt load whenever you do that. So I would advise you to really look at the label and see what the salt content is. Flavoring is okay. There's little flavoring things that don't have salt in them, but that's something I would definitely look at.
I would like to compliment here, as we said before, the first and most important recommendation that we do to prevent stone are liquids. But the second most important will be decrease the amount of salt. Why? Because salt is sodium, and sodium will increase the excretion of calcium in your kidney. So this is why Dr. Sapir was saying that this drinks that you do after exercise, they will have salt. So always a recommendation will be careful with the amount of salt that you're eating. Our guidelines suggest that you can have no more than 2.5 milligrams a day, which is very difficult to calculate, but at least be sure that you're not using the shaker when you go outside, or that you avoid as much as possible the packed food, which by definition is salty.
One thing I say, and I'll just echo this, I saw someone else had a comment about pepperoni. So unfortunately, most of the foods that we like to eat, that we get from restaurants, that we get packaged, have salt in them because that's what tastes good. Our body has learned to like salt, learned to like sugar. So you really have to be careful with any of these foods that are either packaged meats or, packaged pre-made foods, that they don't have a lot of salt in them, because that's something that is an easy way that could increase your risk of stones, and also potentially an easy way to reduce your risk of stones if you can cut that back.
And then to transition a little bit to treatment. So does surgery actually remove the kidney stone, or does it just break it up so it can exit through my urinary tract?
So what I say is that the stone is a symptom of your disease, if you will. So I always tell the people, I wish I could cure you if we remove the stone, but unfortunately, if you have a condition that produces stones in your kidney, then even if we remove stone, you have a high risk to form another stone. When the stone is stuck or blocking the outlet of the kidney, this is when it converts in kind of an emergent thing, because if we don't remove the stone and we don't allow the kidney to drain, that kidney may get infected, number one. In addition to the pain, the main risk is infection. So yes, when the stone has moved from the kidney and is blocking the channel, the long channel that drains from the kidney to the blood, called ureter, that is when we need to remove the stone and open the drainage. But again, for people who think that just by doing a surgery in the kidney, moving the stone in the kidney will be cured, unfortunately, this is not the case, because your kidney, if we don't treat the condition that is forming stones, will form another stone.
The only, to build on that, shockwave lithotripsy does not remove the stones. You have to eliminate the stones by passing the stone fragments or stone debris. Ureteroscopy often does remove the stones or makes them into an extremely fine dust that we have visualized as being fine dust. And the percutaneous surgery removes the stones, okay?
And then there's some questions here that unfortunately our panelists don't have all of your medical information, but they can't give you exactly medical recommendations based on this. But I get X-rays and CTs done, and they've found stones. I've had lithotripsy done twice years ago. My latest CT shows more stones in the kidneys. What should I do next?
This is exactly what I was saying. Unfortunately, your kidney should have a condition that is forming recurrently stones. And again, probably the shockwave lithotripsy were successful when they did the treatment to you, or probably the stone was not completely eliminated. So the shockwave lithotripsy fragment the stone, and then your body needs to clear the stone out. If in both scenarios, either that you have formed a new stone, or that the stone was not completely clear, and you are making inside the kidney that this stone grows again, the problem will be to understand what is the condition of your kidney. And we will need to do a metabolic evaluation, as we were saying, with the 24-hour urine, and find the best way to treat you medically, either with diet or, quite probably in your case, diet plus some medication. What medication, we don't know. We need to know exactly what is the condition that your kidney is having at this moment. Having said that, if I may, probably you have had experience that we see you here and then we request this 24-hour urine and then we tell you again, in 6 months you have to repeat it. And the reason why we do this is, number one, is if we give you a treatment, the only way that we can be sure that the treatment is working well or not is if we repeat this same study. But assuming that you did this study 1 year ago and you have not been treated over this year, the condition may have changed significantly from 1 year to the next year. So this is why, unfortunately, we need to repeat this 24-hour urine test on a regular basis in order to be sure that we are doing a good job there.
So if someone has had a stone of a certain known type, how much more likely is that person to, one, have another stone, and two, have the same type of stone the next time?
So within about 5 years, you have 5 to 10 years, you have a 50% chance of having another stone episode. That's at least, and that's if you're that's all comers. So that's all individuals, all patients everywhere. If you have a high risk condition, which we wouldn't really know about until we do the 24-hour urine, you may have a much higher risk of forming another stone in a shorter period of time. So that's one thing to think about.
So most likely, what is the chance that the same type of stone forms?
If you haven't changed your diet or changed with medications, it may still be the same type of stone, although stone composition varies widely and can be a mix of stones. So you may have 80% calcium oxalate, 20% uric acid, and another time you may have 100% calcium oxalate. So it can vary, but it'll probably still be within the same type or general type of stone.
Yeah, but having said that, yes, it may change. It may change, but again, it will depend on what type of diet and how you have modified your diet. There's a particular medication or some medication that we sometimes use that potentially may help changing the stone composition. But again and again, we need to be sure if you underwent another surgery that we have the stone analysis to be sure that the stone is the same or it's different compared to a prior surgery.
So this question is that I had a kidney stone surgery and had to have a stent in for 3 weeks. They couldn't get the whole stone, so I had to go back to surgery again. The whole process took 6 weeks. I couldn't take pain meds because I had to work. Is this normal, and why couldn't they get everything during the first surgery?
That is a very frequent and very good question. So unfortunately, it will depend on the size of the stone. The most, when we plan a treatment and we consult the patient, we always tell them that the most important factor to predict that your kidney is going to be stone-free, that means with no residual fragments, is the size of the stone. And the second most important factor is to know where the stone inside the kidney is located, because inside the kidney we have some sort of like cavities that we call calyces, and sometimes you have a big stone in the center of the kidney and some other stones in the branches which are the calyces. So I'm assuming that that the reason why probably they were not able to complete the surgery is because you have a large stone or a large and branched stone. And this is always something that we need to tell the patients. If the stone is large enough, you may need 2 stages, 2 surgeries to completely remove the kidney. The reason why they left the stent between the 2 surgeries because the stent allows or facilitates the placement of instruments for the complementary surgery through the ureter into the kidney.
And the stent keeps you safe in the interim. So
Right.
if you have a stone piece, it prevents it from moving into the ureter and causing a blockage. So it's technically the safest thing we could do, as unpleasant as it may be.
And then, how long does it take a stone to form?
It varies widely. Some people it may take years, some people it may take months. It really just depends on the stone factors that we kind of talked about.
Yeah, this stone disease is a multifactorial disease, and Dr. Zampini was talking about the potential risk of genetics or hereditary factors, but there are some others. And one of the well-described factor is weather. I mean, the stones are more frequent in areas where with hot weather. So it seems that during the months of summer in these places where the temperature is higher, that is when the stone formation can start. Now, when the stone will become clinically evident, this is a different history. But probably the stone formation, because people drink less liquids or lose more liquids through some other ways, not through the urinary tract, that's when the stone formation can start in these months where the heat is more.
Also, that's very true. Like a lot of people, the reason is we don't drink enough in the summer. So we're sweating more, we're losing more water in different ways. We don't realize it. We don't compensate by drinking more water when we really should. Thirst is a terrible metric for how much water we should drink. We really have to measure it and be systematic about how we measure and drink our water, or fluids in general, because otherwise we may not be getting enough to really prevent or help ourselves with our stone risk. Also, different kinds of stones can grow faster. Uric acid stones tend to come back pretty quickly, whereas other stones may be slow growing.
And what is the threshold in size that a stone will pass on its own?
Yeah, so most of the study agree that if you have a stone that is 6 millimeters or less, have a good chances to pass. The second factor would be where the stone gets stuck when the stone is moving from the kidney to the bladder. So again, it has to drive through all this long tube called ureter. And if the stone gets stuck closer to the kidney than to the bladder, it will take longer time to pass or may not pass. But if you have a stone that is 5 or 6 millimeters or less, and it gets stuck close to the bladder, you may have up to 70% chances to pass the stone. So again, the main two predictors for stone passage will be the size of the stone. Everything will be below 5 to 6 millimeters is better prognosis. And the location where the stone gets stuck in the ureter, and the better prognosis will be distal, so closer to the bladder than to the kidney.
Does taking potassium citrate tablets help?
Yeah, we kind of mentioned that. So potassium citrate can add more citrate to the urine, and citrate can be protective or helpful to prevent you from growing or forming new kidney stones. It's again kind of based on your overall risk profile, your 24-hour urine test, and the type of stone that you have. But in some patients, it's definitely recommended. In some patients, we may recommend a more dietary source of citrate instead.
Someone asked, in the kidney, I have a 7 millimeter stone that was embedded inadvertently by a doctor during a 2016 surgery. I am scheduled for sonic surgery on May 23rd. What is the typical recovery time, and what level of pain, intensity, and duration can I expect after shockwave therapy?
They are suggesting short-wave lithotripsy. The first thing I will say in this case, if they tell you at some point that the stone was embedded, what means embedded means that the stone is not free in the internal part of the kidney, which is the drainage part of the kidney. So if it's embedded, maybe embedded in the tissue of the kidney, and the short-wave lithotripsy may not do any effect on there. It cannot break the stone in that area. That is an area probably you should avoid this treatment. But if your urologist tells you that it can be treated with short-wave lithotripsy, that is the advantage of this treatment. It's a less invasive treatment, and you can be doing your normal activities the next day after the treatment.
Yeah, some people have some pain on their back or around their kidney for the day after surgery. Typically mild, and typically doesn't stop you from doing your daily activities.
This person says that they have a whole food, plant-based diet, which makes pairing oxalate and calcium sources tricky. Their calcium sources mainly come through cruciferous vegetables and leafy greens. Leafy greens have calcium, but they have oxalates. Commercial nut milks are fortified, but they make their own, so they are not fortified. What supplement, if any, should I add to calcium? Should I add calcium? Take calcium.
What supplement? Great question. I guess, I would probably first want to see what your 24-hour urine test is, just to see how far out the oxalates were. You mentioned you're truly like vegan, so no fish sources, like sardines are a great fish source of calcium. But if you really can't take anything else from a dietary standpoint, sometimes we do use like a calcium citrate supplement with meals. 1 tablet with each meal or with 2 meals or even just 1 meal a day. Sometimes that can be helpful, but we also don't want to overdo the calcium and do more than 1,200 milligrams of calcium a day too. So it's a balance, it's a balancing act. That said, in general, oxalate-rich foods like you guys are describing are healthy, right? So there's no studies that show that pure eliminating all oxalates will eliminate your risk. So it really is about balance and finding a middle ground.
And I want to add something. It is very important if you're going to use calcium supplements to decrease the amount of oxalate, you need to have them immediately after the main meal. A lot of people have the calcium supplement at breakfast, which is not a main meal, or even between meals, and that will not help at all. The only way that this calcium is going to help blocking the oxalate is if you take it immediately after the main meal. So, immediately means in the next 15 minutes after you have finished your main meal.
And what level of sodium is recommended in your diet?
1,200 or 2,400 milligrams a day, max. 2,300 milligrams.
I had a 24-hour urine test done maybe 10 years ago and was put on the drug allopurinol. But now I have more stones in the kidneys. Does that drug really work?
So allopurinol is a medicine that can help it just and only just if you have elevated level of uric acid in the 24-hour urine collection. So again and again, we need to have this 24-hour urine to see what is the level of uric acid. Even people who form stones made of uric acid, if there is no evidence of uric acid or high uric acid in urine, there is no reason to use allopurinol. So to your question, is it working or not? Probably what we need to do or what you need to do is update what is the current status of your kidney. If you have been using this drug for 10 years, probably you don't need it anymore. And then probably there's something else that you have to do. But again, we need to understand what is this kidney screen.
All right. I think that's the end of our questions and about the end of our time. So thank you all for joining. It's been a pleasure. If you have any more questions, feel free to visit us at clevelandclinic.org/kidneystones. And if you want to get an appointment with any of our experts, please call the number at the bottom there, 216-444-5600.
Very nice to
Thank you.
speak with all of you.
Thank you.